Good afternoon. I'm David Sweat, Deputy Director of the Shelby County Health Department, and welcome to the City of Memphis and Shelby County Joint COVID Task Force press briefing for the 14th of January. To give you an update on some of the numbers, we have reported as of in Shelby County so far 76,043 cases. That's 548 new cases today. We've had 1,093 reported deaths, and that includes an increase of 31 new deaths reported in the last 24 hours. In Shelby County, we have tested 884,001 times, and we have an overall positivity rate of about 9.8 to 9.9%. The total number of cases in the state of Tennessee as of 2 p.m. on January the 13th was 665,499 reported cases. In Tipton County, Tennessee, 6,030 cases have been reported. DeSoto County, Mississippi, 16,717 cases have been reported. And in Crittenden County, Arkansas, 4,595 cases have been reported as of 10 a.m. today. Some of the other numbers that we pay attention to is hospitalization data. Certainly, we have had improvement in our number of people hospitalized. We had 535 people hospitalized at 5 p.m. in our local hospitals yesterday. And in terms of our progress against the vaccination campaign, we've so far in the Tennessee Immunization Information System, we have 24,195 vaccinations documented. That's as of January the 11th, 2021. Representing 1.89% of the population in Shelby County and 3.7% of our target goal of 650,000, et cetera. And the reproductive rate of the virus at the moment has improved in our community to being at 1.01, meaning that each case is creating one new case, slightly more than one new case. And that is down from where we were a few weeks ago, and that's evidence that all the efforts that are being made in Shelby County to slow the spread and protect one another are having an impact. We are reducing the rate of increase. We are still increasing or maintaining at a plateau, though, and we need to stay the course so that we can continue to drive that RT down below 1 and begin to shrink the number of future cases. With that, I'm going to turn it over to Dr. Haushalter.
Thank you, David. Alisa Haushalter, Director of the Shelby County Health Department. I want to speak specifically to vaccines because there's a lot of questions and a lot of interest in vaccine. So I want to make sure that, one, we're given updates, but also that people know where to get timely information about vaccine availability in Shelby County. Just a reminder that vaccines have come to our county through a variety of avenues. One, through the state health department, Tennessee Department of Health, healthcare systems as well as public health are receiving vaccine. And healthcare systems are primarily at the current time vaccinating their staff and team members. Public health has a responsibility to offer vaccine to a wider audience, particularly those that are in the 1A1 and so on categories that are not within a healthcare system. But also pharmacies are beginning to receive vaccine and have received some vaccine through a federal allocation, and their responsibility is to provide vaccine to those who live in nursing homes that have an agreement with that particular pharmacy. At a later point, others will be able to receive vaccine, and pharmacies will also receive state vaccine. So we know that this campaign is going to last many, many months. We are planning for the full year of 2021 because we know there will be ongoing changes. Late on Friday, we learned the number of doses that would come to Shelby County, that would be 8,900 doses shared between the health department and healthcare systems for the remaining 3 weeks in January. So based on that allocation, we established a drive-through vaccination site at the Pipkin Center, and that will be a permanent site that we'll use moving forward. Within 24 hours, all of the appointments for the remainder of January were filled. Unfortunately, we could not appoint beyond February 1 because we did not know the amount of our allocation moving forward. In recent conversations with the state health department, we understand we will have much more predictability on weekly allocations of vaccine, likely beginning February 1. So I encourage people to stay current with information from the health department so that you know, one, when we have openings, which populations we're vaccinating and which sites there's vaccine available at. As I said, we started with the Pipkin Center, but we will have other permanent locations that we will open up in upcoming weeks. And then we anticipate also having some moving sites. And then particularly for those of you who receive commodity food, we'll be working to try to make it a very convenient way for you to receive vaccine through the commodities site. So more to come on that. But there are several places that you can get information. One, if you do have internet access, you can go to shelby.community, and that will be updated regularly. Additionally, our team releases at 10 o'clock every day a daily update, and that's sent to the media and through other partners, and that'll include updates on vaccine. But also we'll give updates here at the press conferences, and when there are immediate changes, we'll send out a press release, and we will also send that to elected officials as well as community partner agencies so that we can get information out. There are also 2 phone numbers that you can call, and I want to stress these are 2 different numbers. So the first number is our hotline, which we have had open for some time, and that's 901-222-MASK or 222-6275. That's where you want to call if you need information about COVID or if you have a complaint that you would like to give to us. You can also email us through Shelby TN Health. But we have a separate line that is just for appointments, and that is 901-222-SHOT or 901-222-7468, and that's where one can call for an appointment. I will remind everyone that we currently don't have appointments available because we're waiting for information on the allocation, but we do anticipate in the upcoming days we'll be able to announce that we have appointments again, and then you can call in for an appointment. So I'm going to stop there and turn it over to Dr. Randolph, who's going to highlight some of the key things we need to continue to do. As David said, we have plateaued, but we actually want to decrease our reproduction over time, and so it's time to stay the course. And so again, turn it over to Dr. Randolph.
Thank you, Dr. Haushalter. Greetings, fellow citizens of Shelby County. I'm Dr. Bruce Randolph, the Health Officer for Shelby County Health Department. I just want to first thank all of you, fellow citizens, for your cooperation and compliance with the Safer at Home. We only have 8 more days before it is due to end on the 22nd, and we've made some progress. The data suggests that we are sort of levering off. There's some indication that we may be having a decrease in the spread, and so now is not the time to let your foot off the gas. We really must remain steadfast and continue to do the things that have allowed us to get to this point at this time. And so again, we want to remind you to continue to wear your mask and continue to remain separated 6 feet, not together in the crowds and the gatherings. And again, it's very important that if you're sick, stay home. Do not go to work if you're feeling ill. We're asking employers not to require their employees to come to work if they're feeling ill. And we're also reiterating the importance of still avoiding indoor gatherings, really be conscious of indoor settings where ventilation may not be adequate. And if indeed you get tested, that you remain home until you know the results of your test. And if it happens to be positive, that you remain in isolation for at least 10 days. If you've been around someone who's been infected, that you remain in quarantine for at least 10 days. If you don't have symptoms, any fever, after 10 days you can be released. The other thing is we want to encourage you to get vaccinated. It's very important that all who is eligible to get vaccinated now, that you do. And I would encourage you to learn as much as you can about the vaccine so that you can make an informed decision to receive it and not just rely on the myths and the errors and rumors that's out there on the social media and internet. So if you have some questions, feel free to contact the health department about the vaccine. We are available. And along those same lines, in terms of getting information out to the community, we will be reaching out to community leaders, community influencers to help us get that message out to people about the COVID vaccine, the side effects, the safety and effectiveness, and to answer questions that people may have about it. I will stop here, and we will entertain any questions that you may have at this time.
Brad Broders, Local 24.
Thank you. Well, Dr. Randolph, while you're still up there, first question, I know that numbers have sort of plateaued, leveled off. Is the hope or the possibility that the next health directive, January 22nd, could potentially roll back certain restrictions?
Well, we won't commit to that at this point. We're still waiting to see what the remaining days, but we certainly will respond accordingly.
Thanks. And second question is to Dr. Haushalter. You probably saw yesterday and this week in Mississippi, they opened up more groups, and then the system was immediately slammed. They ran out of supply. They had to postpone appointments through until mid-February. Does that kind of give you all pause as you're potentially adding more groups to make sure the demand and supply can kind of match as best as possible?
It's a great question. So it really is about supply. We've talked about that here before. It's not only knowing how much our supply is, but predictability on when we'll receive it, and then having appointments accordingly. The other thing is we have a very large population, and so we need to be able to move through those phases in an organized way so that everyone in those early phases has an opportunity to get their vaccine. We've been receiving questions particularly about those over 65 because that's been in the media lately, and we have a large number of people over 75 that are still trying to access vaccines. So we're monitoring supply and demand and trying to advocate as much as we can to the state for increased supply so that we can get through those early phases much quicker.
Sam Hardiman, Commercial Appeal.
Dr. Haushalter, you've mentioned opening a vaccine station or distribution station in Whitehaven. What is the timeline on that right now? Are you just waiting on clarity from supply for the state?
No, we're actually waiting on the contract to be finalized, and once the contract is finalized, we can announce that site. We want that to be a permanent site. It may not be open 5 days a week, but it'll be a permanent site. Then we're also working with other partners to identify some other permanent sites throughout the community. And as I said before, then we'll have some roving sites so that we make sure that it's as easily accessible as possible. I say all that, and then I'm going to make the notation of supply is critical. So we can't open up too many sites if we don't have sufficient supply of vaccine. So really waiting for the changes that we expect to come after transition to the Biden administration. Do you have a follow-up?
And yes, my follow-up is for you, Dr. Haushalter. Correct me if I'm wrong, but many times you've described gun crime and violent crime in this community as a public health crisis. in your opinion, what are the public health options to stymie that?
So, one of the things I have said here is that if we invested as much time and energy and coordination into gun violence, we would have some positive outcomes. So I think the first is, one, recognizing that it is a public health crisis. It includes an enforcement component, education components, but that it's truly going to take a coordinated effort to reduce the impact of gun violence in our community, and that it's going to take some time and we have to stay the course. But within that, there are a wide array of interventions that can be put in place, everything from early detection of either ACEs, behavioral health challenges, educational challenges, and getting children and families the support they need, all the way up to interventionists who work in the emergency room to determine who's at risk of either committing gun violence or being a victim of gun violence and intervening. Data is another component of that. Everyone's very accustomed to us releasing infectious disease data. We've not done as good a job on violence-related data, so getting data out so that people understand the scope of the problem locally. And then ultimately, there are always policy solutions that elected officials can entertain to reduce gun violence as well. And then lastly, what I'll say are there are system things that we need to look at, including our ability to get people to the emergency room, things like ambulance time and so on that might increase survivability. And all of that's going to take commitment, coordination, and really a commitment of time over time.
Kelly Roberts, WMC.
Good afternoon. My first question is about vaccinations by race. Are you guys seeing some kind of disparity? Can you confirm that of those recorded based on race, about 24% of those vaccines given were within the African American population, and then more than 51% in the white population? And if you are seeing this disparity, in this time where we're waiting to set up more permanent sites and the supply, is still just not exactly there, and we're waiting for that to ramp up, what are the thoughts about diminishing this disparity at this point?
So I would actually say at the current time, we can't calculate that it is a disparity, and I'll make some comments about that and why I think at the current time we have data, but the interpretation still needs some additional information. The first phases really were focused on first responders and healthcare workers, and then we opened it up to people over 75, and then those who were funeral directors or people who provide mortuary services. We don't know amongst that population how many are African American, how many are Caucasian, and how many are Latino or other races. So we can only look at that pool initially to determine if there's a disparity. So I'm not ready to say there is a disparity. What I can say is that we know long term we have to put mechanisms in place to assure equal access and that people have information to make an informed decision, and that's something Dr. Randolph mentioned earlier. So a few things that we have been doing and will continue to do is really striving to get education and information and whatever people need relative to information to a variety of communities so that they have enough information about the vaccine to make a decision. The second is we will have an online sign-up system and a phone system so that people can call in. And then we will also aim over many months, because as I said, this is a long campaign, to continue to have various sites in different communities. And we can use some of our existing data around burden of disease, social vulnerability, and so on to identify where those sites should be. With that said, no system is ever perfect, and so we will always look at what we're doing and what we can improve to be able to reach various communities. So an example I'll use, there was a lot of feedback that when we had the Lindenwood site open, there were people who came to that site who did not have appointments, essentially cut the line and so on. I'll reinforce we were following the instructions of the state health department and who we provided vaccine to. But we also had a lot of feedback from the community and media, what is it that you're going to do to make sure that people who need to be vaccinated and are eligible actually get in the line? So we went to the appointment system. We also said, please be prepared to bring your driver's license or some other proof of your eligibility. Well, the truth is that also serves as a barrier to some people who may not have a driver's license. So that's a change that we need to make so that everyone knows that they're welcome to get the vaccine if they fall within those categories. Thank you.
Kelly, and just my follow-up question is dealing with rapid response technology. I know that there's been some talk about it here. We see it in use in the Jackson, Tennessee area, where someone can go online, put their name on the list, and basically maybe get a call at the end of the day if there are some thought out vaccines that haven't been accounted for that do need to be used. What are the thoughts of something like that here?
So we actually have something in the works here locally that would allow people to get in the queue for vaccine. But there's a few other things that I think are important to mention. With the Pfizer vaccine, some communities will have, and some healthcare systems will have what's called an any arm list, which essentially means it doesn't matter if you fall in a category, if you're available in a timely manner, you can get the shot. What we want to do is focus on those priority populations and have a waiting list or a queue that we could contact those individuals, one, if we have open slots during the day, or if at the end of the day we have unused vaccine. What I can tell you is we've done an exceptional job locally of not having extra doses at the end of the day. The first couple days you get into a routine, but this week we've been fairly accurate in what we appointed and how many people showed up so that there weren't extra doses at the end of the day. But again, we are working on the vaccine queue and anticipate some updates from IT either later this week or early in the week. Thank you.
Jacob Steimer, Memphis Business Journal.
Yeah, thank you. First question, Dr. Haushalter, I want some more clarity when you're talking on Tuesday about it taking us longer as the largest county in the state to get through some of these categories. Is that because we're not getting enough doses to deal with our larger demand, or do you all not have the capacity to keep up with the pace of smaller counties?
No, it's two things. One, we have a much larger population. So an example is we may have thousands of people who fall in the first responder categories, and some of our surrounding counties may have 100 or hundreds. So just the sheer numbers are greater here. And we are receiving vaccine based on population and something called social vulnerability. But if you consider that we have to vaccinate to reach that 70% goal, well over 650,000 people, not once but twice, to receive 8,900 doses of vaccine in 1 week, and only a portion of that coming to public health, we don't have sufficient supply. That's not a criticism of the health department at the state level or even the federal level. That's just the reality of the allocations that are coming to our state and the reallocation at the county level. We have sufficient resources and manpower, and that's for several reasons. One, the county has allocated resources just like it did with the initial COVID response. We have a very large team. We are continuing that team even though there's no longer CARES Act, but we'll also add probably another 75 or so positions that are dedicated to nothing but vaccine. But beyond that, we have many partners through the Joint Task Force who have stepped forward to offer assistance. And that's everything from offering locations for us to give vaccine, to offering police and law enforcement support to help with traffic control, offering people to do logistics, and offering people to help with vaccine. So we can mobilize very quickly through all those partnerships, and I think as a community we've done exceptionally well with partnering. However, we can't do anything if we don't have sufficient vaccine to get out to the public.
So I guess what I'm asking is what you're saying that we're slower than the other counties because we're not getting enough extra supply for our extra people and hospital workers? I'm just trying to understand the comparison there. If the allocation is based on population, why the smaller counties have been able to.
I wouldn't actually say we're slower. That connotes something that I don't think is consistent with what's happening. It takes us longer to get through each phase because we have more people in each phase. The other thing, and we haven't compared this to other counties, we may actually have better uptake and demand for the vaccine. Some communities may not reach that 70% goal. And so we have a lot of people who are actually demanding the vaccine. And when I say demand, it's really from a supply and demand perspective, that want the vaccine. And so we are getting a large proportion of those critical phases and people within those phases early on. So it will take us longer to get through those phases. It is just the reality of it. We have X number of doses and thousands upon thousands of people to vaccinate. And so we will get through those quickly. We don't have any vaccines sitting on the shelf. It's important for people to hear that because nationwide there is things in social media and on the news that vaccine is just sitting on shelves. It is not sitting on the shelf here. When it comes to Shelby County, whether it comes to us or the healthcare systems, we get it out. But we have a large number of people to vaccinate.
Jane Roberts, Daily Memphian.
Dr. Haushalter, can you talk about when we think in Tennessee we'll hear about the people who are 65 and older, and also any sense of how much more vaccine could be available under the Biden administration?
Yeah, so under the Biden administration, all we're hearing is that they're going to open up the supply chain, but that doesn't give us an exact number at the current time. I would expect that to be forthcoming after the inauguration. And then if you don't mind, repeat your other question.
Could you comment on when the state is expected to start vaccinating people who are 65 and older?
So really, the phases, everyone's seen a picture of that graph. When communities get through those particular phases, they can go ahead and move to 65. So there may be some communities already at 65 because they've already done all of their healthcare workers, all of their first responders, and all of their funeral directors and so on. They could move into 65. Otherwise, we'll wait, but we don't have a date that we anticipate them saying widely open to age 65 and above.
Those are all of our questions today. Are there any closing messages?
Just want to remind everybody that I know this has been hard work for everyone. We've all had to make changes over the past year, but we are seeing that we've gotten past the holiday surge, and we've been able to manage that surge locally, and that is because of all the work of everyone here in Shelby County. So we really appreciate the efforts of our entire community, including our staff, and just ask everyone to please stay the course.
Thanks, everyone.